Hello and welcome to our webinar on face masks and respirators. My name is Janelle Bentz. I'm a study director here at Nelson Labs, and I am excited to be sharing with you some information about the testing we perform and these important products. Many seasonal ailments are spread through respiratory droplets. Simply being around people who are coughing and sneezing without covering that cough or sneeze can lead to transmission in many cases. During outbreaks, personal protective equipment becomes increasingly important. Recent news stories include masks and respirators that are being stolen, shortages of these personal protective equipment, and manufacturers running at full capacity. Some cities are even requiring residents to wear face masks or respirators. Face masks and respirators are frequently used both to contain respiratory droplets from the infected individuals who are wearing them and to protect the respiratory tract of the wearer. Let's talk about some of the testing that's required for these items, the differences in the testing and the functionality of these items. We'll start off with some terminology, discuss respirators and their testing, face masks and their testing, some tips for preventing the spread of disease, and finish up. Terminology that we use in our testing includes a consensus standard, which is a standard which includes several test methods that should be performed for product certification and the requirements for product performance. These standards can also sometimes include test methods. A testing standard includes only the test method. It describes how to perform the test method, what equipment is needed, and how to use that equipment to test the face mask or the respirator. Titer is a word that we use often in microbiology, and it basically means the concentration of an organism. The organism is determined a concentration by using standard microbiological techniques, and it's generally reported in colony forming units for bacteria and plaque forming units for viruses. A respirator is a mask that fits tight to the face, and it's used to filter breathing air. You can see underneath the respirator a little bit more terminology. N95, N99, and N100 are classifications used by NIOSH to indicate the filtering capacity of the mask. FFP1, FFP2, and FFP3 relate to the European standard for respirator testing, and you can see next to those the filtration percent that they're required to demonstrate in order to have that labeling. A face mask is a loose-fitting mask for the face, and it's meant to block large splashes and sputum from coughs or sneezing. You can see below there level 1, level 2, and level 3, as well as type 1, type 2, and type 2R. These are the classifications for face masks in the US and Europe, and we will talk about them more in detail later on. BFE, VFE, and PFE are shorthand for bacterial filtration efficiency, viral filtration efficiency, and particulate filtration efficiency. These are some of the tests that are performed for face masks and respirators. Face velocity is the flow rate divided by the test area. It can be reported in meters per second and is important in noting the differences between some of the testing. A very small test area with a very high flow rate has a high face velocity, which results in a more challenging test. So determining which product to use, I've listed some of the differences between face masks and respirators. As we discussed earlier, face masks are usually loose-fitting. They're highly breathable, and they're meant in general to protect the environment. They block large droplets from a cough or a sneeze, but may not block small particulates from coming in when the wearer of the face mask inhales. These type of products require medical and biological testing, which includes bacterial filtration efficiency, particulate filtration efficiency, blood splash, flammability, and other tests. They have level and type ratings, and here in the US, for level 2 and level 3 masks, they require FDA approval. Respirators are tight-fitting to the face, and they're less breathable than face masks. This makes it so that they can protect the wearer by blocking small and large particles. They're required to have more physical testing than the face masks, with filtration efficiency, breathability, valve leak testing if an exhalation valve is included, and fit testing to ensure that the tight-fitting respirator seals all the way around the face. Here in the US, they receive an N rating for particulate respirators, and NIOSH approval is required for all respirators. You can see in these photos the difference between the fit from the side of the face of a face mask on the left and a respirator on the right. So respirator testing. As we mentioned, respirators are meant to protect the wearer from airborne contaminants. They fit tightly against the face and are subjected to testing to prove their effectiveness. Since they are made to protect the wearer, the outside is the default test side for filtration efficiency testing. There are two respirator standards that we'll mention. One is the NIOSH standard, is 42 CFR Part 84. This is a consensus standard that tells the requirements for the face mask. It does describe the testing somewhat, but the TEB standards below are the three standards which describe in detail the testing for filtration efficiency, inhalation, exhalation resistance, and valve leak testing in the US. EN 149 is the standard required for respirators in Europe and includes similar testing to the US, but also additional testing. NIOSH requires a pre-testing at a certified lab such as Nelson Laboratories before an official submission for a NIOSH rating is received. Test articles are subjected to the testing that they will be required to pass at NIOSH at the pre-certification, and once they've proved that they can pass those tests, NIOSH will perform the official certification testing as well as the fit testing. NIOSH does monitor masks, and they purchase previously certified masks and subject them to the same testing to ensure that they are still performing as they should. In addition, not everyone should wear a respirator. Respirators can interfere with breathing, and medical conditions can preclude their use. So prior to use, the user of a respirator should consult with their physician. Filtration efficiency testing is the first test for respirators. This determines how many particles a respirator can remove from the airflow. For N ratings, the particles that are used are sodium chloride. NIOSH also certifies oil-proof and oil-resistant respirators, and for that testing, dioctyl phthalate is the oil used for testing. This testing takes place at a high flow rate of 85 liters per minute with a very severe challenge of a 0.3 micron particle size sodium chloride. Prior to testing, the samples are preconditioned for 24 to 26 hours in a high temperature, high humidity environment. After conditioning, the respirators are subjected to testing with this 0.3 micron particle size. The most penetrating particle size is often discussed in HEPA testing. For this testing, the 0.3 micron has been determined to be at or near the most penetrating particle size for this type of filter. In addition, during this testing, a neutralized particle is used, which would take away any of the effects of an electrostatically charged filter. Combined with the high flow rate and the small particle size, this makes for a very challenging test. In order to achieve an N95 rating, 95% or greater of the particulates must be filtered out. For an N99, 99% must be filtered out, and for an N100, 99.97% of the particles need to be filtered out. The next test for respirators is inhalation exhalation testing. This test evaluates the breathing resistance, or how difficult or easy it is to breathe through the mask when it's being worn. Again, that 85 liter per minute flow rate is used, and the requirements for resistance include 35 millimeters of water for inhalation resistance and 25 millimeters of water for exhalation resistance. In order to be accepted by NIOSH, these resistance values cannot be precluded. For respirators that include an exhalation valve, there's a valve leakage test. This test, as the title indicates, evaluates the leakage in the valves. 30 milliliters per minute is the limit for leakage in valves. This is to make sure that when an exhalation valve is present in a respirator, there's not leakage that would overwhelm the use of the respirator. So that valve isn't leaking and making it so that the air that's breathed is not filtered. Fit testing is also required for respirators. Fit testing determines the appropriate fit in one of two ways. There's qualitative testing, which is a pass-fail and generally uses the wearer's sense of taste or smell to detect a testing agent. And there's quantitative testing, which uses an instrument to determine how well the respirator is functioning. The fit testing can also evaluate the effect on the fit or the seal of the respirator that facial hair may have. And fit testing is required annually for those who use respirators regularly. So those are the tests that are required for respirators. Let's move on to medical face masks. Medical face masks are designed to protect others from wearer-generated aerosols. This helps prevent the spread of airborne diseases and helps maintain a clean environment in the surgical suite. As they are designed to protect the environment, the inside is the default test site for most of the testing. There is one test that is meant to evaluate how well the mask protects the wearer, and in this testing, the outside is the test area or the test side. Face masks are commonly used by healthcare workers to prevent the spread of illness within hospitals and nursing homes. If you are ill and will be around others, it might also do you good to wear a face mask. So there are two sets of standards for face masks that are most frequently used. These are the US standards, which are in the dark blue under ASTM F2100, and the European standards, which are in the light blue under EN 14683. You can see in the table that not all of the testing is required for every mask or for each standard. This is important for manufacturers to know, as they need to determine what level or what type of a mask rating they need in order to know which testing to choose. We'll talk about these tests in more detail as we pursue our knowledge. Bacterial filtration efficiency testing follows ASTM F2100 and EN 14683. These two standards indicate how to do the test. This testing measures the filtration efficiency of the mask material in filtering a bacterial challenge. The flow rate for this testing is 28.3 liters per minute, which, if you remember the NIOSH testing, is about 1/3 of the flow rate required for a respirator test. Depending on the level or type that the manufacturer is claiming, these face masks need to filter out 95 or 98% of the bacteria that they're challenged with. Bacterial filtration efficiency testing uses Anderson samplers, which are six-stage cascade impactors that mimic the human lung. You can see in this image taken from the Anderson sampler manual the size of the particles that are impinged on the plates and the expected location of their impingement in the lung. These Anderson samplers allow for sizing of the challenge droplets, and they collect droplets from a range of 6 microns to greater than 7 microns. Differential pressure testing is the breathability test for medical face masks. This testing is performed per the standard EN 14683, which includes a test method and requires a very low flow rate of 8 liters per minute. The pressure differential indicates how easy it is to breathe through the mask, and this is an important factor to evaluate for comfort of the wearer. Synthetic blood penetration testing is the one test that uses the outside of the face mask as the challenge side. This test follows ASTM F1862 or ISO 22609 and is to evaluate how well the face mask protects the wearer from a spurt of blood. This is something that could potentially happen in an operating room, and we want to make sure that the physicians and the operating room staff are protected. The 3 pressures that are available for this testing mimic low, normal, and high blood pressure, and the way a spurt would hit the face or the mask of a wearer in this case. Biocompatibility testing is required for face masks as well. These, like the differential pressure tests, are tests to help ensure the comfort and the usability of the mask to make sure that the person wearing the mask will not have irritation or sensitization or some sort of toxicity from the materials that the masks are made of. Microbial cleanliness testing is required only in Europe, and it determines the microbial burden of the masks or how many microbes are detected on the masks after they have been manufactured. The masks are submerged in a growth media to extract the organism, and then the organisms are grown and counted to determine how many microbes were present on the masks. Particulate filtration efficiency is required only by the United States and follows ASTM F2299. It determines the ability of masks to filter out particles of 0.1 microns, and again uses that low flow rate of 28.3 liters per minute. Flammability testing is required also by the US and determines how quickly the materials burn. Depending on the burn rate, these materials are certified as Class 1 or Class 3. Viral filtration efficiency testing is not required by either the US or Europe, and it does not follow a published standard. Viral filtration efficiency is a test that we offer here at Nelson Labs to help determine how much virus a mask would filter out in a similar test to the bacterial filtration efficiency test. We've modified the testing to use virus and use the same 28.3 liter per minute challenge flow rate for this testing. So if viruses and bacteria are so small, you can see on the slide, Staphylococcus aureus is about 1,000 nanometers. Coronavirus is 120 nanometers, and the Phi-X 174 bacteriophage we use in our testing is about 27 nanometers. Why do the standards require a 3 micron particle size for bacterial filtration efficiency testing? You'll notice in the bottom right-hand photograph, someone is sneezing. Most bacteria and viruses are not viable as discrete particles. In order to be floating around in the air, these pathogens are usually in some sort of a respiratory droplet, and the droplets are generally in the sizes that you saw on that Anderson sampler, from 0.6 microns to 7 microns. So in spite of the very tiny size of the challenge organisms, we challenge with a 3 micron median size in the bacterial and viral filtration efficiency testing to mimic the droplets that you might see from a cough or a sneeze. What else can we test? Some additional testing for face masks and respirators are real-time and accelerated aging to help determine shelf life, a sterilization validation if these products are used in a sterile field, and periodic testing to monitor any drift that may happen due to changes in manufacture or raw materials. One type of protective equipment I'd like to mention as we wrap up is a surgical respirator. These are generally used in highly infectious cases where both the surgical area needs to be kept clean and the technicians in the surgery need to be protected. These products are subjected to respirator testing as well as blood splash testing and help keep the staff protected as well as the patient. So what else can we do to minimize viral transmission? In general, the World Health Organization recommends good hand hygiene, the disinfection of any surfaces that may have come in contact with someone or something that was exposed to a pathogen, educating yourself using reliable sources about whatever pathogen is the primary worry. Avoiding travel if you have symptoms of a cold, the flu, or any other viral or bacterial infection that might be prevalent. Covering your coughs and sneezes with your arm so that your hand is not infected and touching surfaces. Being extra cautious if you're in a high-risk group or have those around you in high-risk groups. High-risk groups generally include folks who are over 60 years old or anyone who's immunocompromised. Stay at home from work if you feel sick so that you're not sharing this with your coworkers, and see a doctor if you feel unwell or exhibit any symptoms of a current viral or bacterial infection. Some recommendations for personal protection. The Centers for Disease Control does not recommend wearing masks if you're generally well. Masks should be used by people who have symptoms to help minimize the spread of disease. If you are wearing a respirator, you should have fit testing to ensure that the respirator is worn properly. In addition, as we mentioned earlier, some health conditions may be exacerbated by respirator wear, so make sure to consult your physician if you have any doubts. There's some additional information available on the following websites. NIOSH keeps a list of approved respirators. And you can see on the CDC website that list of respirators. You can search for approved level 2 and 3 face masks on the FDA website. And then there are some helpful information about infection control from the Centers for Disease Control. Thank you so much for attending our webinar. If you have any questions, my contact information is here. Please don't hesitate to reach out.